I'm libertarian, I don't like to be told what to do. Friends, healthcare is kind of like the Mark Twain comment that everyone likes to talk about the weather, but no one does anything about it. And so we have a president who decided that he could do something about it. And the problem is, as we learned from Ronald Reagan, if you get in bed with the federal government, you're going to get more than a good night's sleep. We didn't learn that by Reagan's example, we learned that by Reagan's shared wisdom. But the good news is there's an awakening and people pushing back and thinking, when I'm sick and when my children are sick, I want to see a doctor. I want to have a consultation with my doctor, not have an awkward three-way with a doctor and a government bureaucrat. So people are getting involved and getting more educated about their opportunities to make a difference, and I salute all of you for taking time to be here this afternoon. Let's acknowledge that there are some things that the state can affect, but a lot of the biggest, most important things about who pays how much for what is heavily influenced by the federal government. And for example, the tax subsidy, the fact that health coverage through an employer is tax subsidized, health coverage by an individual is after-tax dollars, that's huge. I mean, that controls a lot of what we can or can't do regarding reform. The fact that over half of all health care is paid for by government between Medicare, Medicaid, and public employees also makes it harder for the states to make much of a difference in the health care. Well, I shouldn't say much of a difference because there are a lot of good or bad things we can do. Nevertheless, there's a whole lot of important turf already controlled by federal policy. Actually, in some cases, it's a good thing that the states can't do more because in Colorado, for example, a lot of what we're trying to do is not good. Let me share with you, before I talk some specific bills, and this is not health care according to the majority opinion in the Colorado legislature, this is health care according to a few important principles that I would like to keep in mind as I approach these issues, and sometimes my colleagues believe me and sometimes they don't, but as we approach health care, number one, as you've heard from other speakers and from various perspectives, the American healthcare system, for all its warts and challenges, provides the best health care of any system in the world. If you are seriously ill, if you have threatening cancer, if you need a hip replacement, if you've got a life-threatening condition in the United States, you will be seen sooner, see a specialist sooner, be treated by more modern methods, with less pain and a better outcome than all the other systems held up by the World Health Organization or championed by so-called consumer health care advocates. That's not to deny that we have problems. That's not to deny that, for example, there are too many uninsured in our society. However, even that is a battleground and a battle of facts and figures. For example, we hear Colorado about 717,000 or, yeah, I think that sounds right. Anyway, the percentage of the population, you hear about huge numbers of uninsured people. The fact is, those numbers are distorted by activists with an agenda. If you take a snapshot of the uninsured today and take a snapshot 1 year later, 50% of that group will have turned over. People between jobs, people starting jobs, people between policies, young people that were entering the job market, and so forth. So number one, there's a huge turnover that way. Number two, some significant percentage of those uninsured, by some accounts, I think the Lewin study, and maybe Linda can correct me on this, but about 20% of the uninsured in Colorado are not citizens. Now, you can say a lot about the humanity of that problem, but it is not a flaw in the American healthcare delivery system that our financial structure in the healthcare system is not designed to include people who aren't legally here and employable in the first place. Different issue. The onion gets smaller as you peel the layers off. It gets smaller still when you realize that over 25% of the uninsured make in excess of $50,000 a year, 13% make in excess of $75,000 a year, and make choices and take risks, and the ball gets smaller and smaller. They're the young invincibles. They're the young men and sometimes young women who think, why should I pay hundreds of dollars a month for that I'm not going to make claims on? And they gamble, and most of them win that bet and come out ahead. Those that lose are caught in the safety net, and we all end up paying. So it's a problem, but it is a different problem from the suggestion that a huge chunk of society is chronically uninsured and uninsurable and the system's broken and we have to fix it. No, what we have to do is zero in on that small, much smaller portion of the universe of the uninsured that really are chronically difficult to insure, can't afford it, hard to cover. And let's not forget that we do have a compassionate public structure with Medicaid and a safety net and community health centers that for the truly poor, the system is there. Let's also not forget that unpaid health care in the emergency room really isn't the biggest cost driver in the system. Undercompensated Medicaid care, the government not paying for the care that it promises people, is the biggest cost driver and cost shift onto the private sector in our healthcare system. So the same government that can't pay the bills that it purports to be, for the care that it purports to offer its citizens, is saying it's going to make things better by taking over the rest of the system. Nonsense. I'm sorry, I shouldn't have taken this long on that, but just a couple more things I like to think about and remind my colleagues while we discuss these healthcare issues. So number one, American healthcare, best there is. Uninsured is a problem, but it's a different kind of problem from the way it's depicted. Number three, debate over whether healthcare is a human right or not a human right, I think is rhetorical arm wrestling that misses the point. It is a human need. Obviously, we need to have health care like we need to have food and shelter. However, we don't think we're better off if the government would only take over the production and the distribution of food and shelter. What we have is a market based on freedom, free individuals who consume, free individuals who provide, and we've got the best range of food and shelter of any country on earth. And we have a safety net for people who can't afford food and shelter, and target aid to where it's needed, not suggest that because human beings desperately depend on food and shelter that the government should be the originator of it, the distributor of it, the controller of it. So we can treat healthcare as a universal human need and craft policies that provide a safety net without suggesting that the government should be in charge of healthcare. Spiraling costs. There are a lot of reasons why healthcare continues to go up. Huge government involvement is one of, just as a quick aside, let me mention, what are two vital goods over the last several decades that go up faster than inflation? While consumer electronics go down, while the cost of many things go down, the cost of two things that keep spiraling upward way above the rate of inflation are higher education and healthcare. Not a coincidence that government is heavily involved in the regulation and providing of those two services.